My name is Matthew Rutter. I'm a urologist. I've been at the Graves Gilbert Clinic for almost 10 years. Well, many folks don't realize what urologists do. They think we're urinary doctors or kidney doctors, and we are, but really we're surgical subspecialists that really work only on the urinary tract, anything that has to do with the kidneys, the ureters, the bladder, the prostate, and the penis and testicles. We offer every full-feature urology need here in Bowling Green. There are 4 of us, and we have 2 nurse practitioners. Some of the treatments that we have for bladder and prostate cancer can have long-term side effects, like urinary incontinence and erectile dysfunction. Most folks know about the medications. They've seen the commercials. Some of them have tried them, but if they're ineffective, they think that that's it. They don't have any option for their urinary control or their erectile dysfunction. So one of the opportunities for patients is to look beyond the pills for the treatments of their incontinence or erectile function and move on to prosthetic surgery. The penile prosthesis is not a myth. It is a pump that we can actually insert into the penis with a pump in the scrotum. And there is a reservoir that holds fluid that we can pump from that reservoir into the penis to create an erection. It's an artificial erection, but it feels natural on the outside. The patient has complete sensation intact, and it's very functional. The nice thing about the artificial erection this way is that it can happen anytime, anywhere. There's no waiting for the medication to work. It's going to work 100% of the time, every time. So this is an example of an inflatable penile prosthesis. These cylinders or tubes fill with saline. These are implanted within the penis. This is a pump that's implanted within the scrotum. And this is a reservoir that we implant behind the pubic bone in front of the bladder. And that's where the fluid is kept until an erection is wanted. When the patient wants one, they would squeeze this. It would shunt the fluid from that reservoir into these to create the erection. They will straighten out and become firm. And then when they are done, there is a button to deflate the device. It's completely concealable. Nobody knows the patient has one in place. The only person that knows is the patient and possibly the significant other, but completely concealable and works 100% of the time. With respect to urinary control, an artificial urinary sphincter is an option. It is a cuff or a balloon that wraps around the urethra with a pump, again, in the scrotum. And you push the button in the scrotum and it releases that cuff and allows the individual to urinate. On its own, it reinflates. There is a little balloon reservoir that is full of fluid that is under pressure, and it reinflates that cuff after time. Men have now had the confidence to go out and mow the lawn without being concerned about wetting their pants, or being able to sit through the whole service at church without having to get up and run to the bathroom. And that really changes their confidence with respect to getting out and doing average, ordinary things we take for granted every day. Many times folks don't want to tell our office staff that they have a question about it or that they want to make an appointment for such a thing. The reality is the staff that we have are very professional. They know what we do. They know what we treat. There is no anxiety or no need for anxiety anyway to come ask us. Some folks aren't candidates for these. Some folks, this is the best option for them. The only way to know is to ask. And so I'm trying to get the word out there to let folks know that these things exist, and that I have the expertise to place them, and I have been for over 20 years. It's just not that well known.